Hello, I am Dr. Keith Burke. I'm a professor of behavioral sciences in the Alcohol and Other Drug Studies program at San Diego City College. The AODS program is a vocational training program for students who are studying to sit for the state certification exam to become certified alcohol and drug counselors. So today I am going to give a lecture on the introductory laws, statutes, regulations, protocols, etc., in the state of California as they apply to alcohol and drug counselors. In California, alcohol and drug counseling is a highly regulated healthcare profession. There are many laws, regulations, rules, ethical standards, and guidelines that shape what an alcohol and drug counselor must do, meaning what is required, what they should do, which is essentially means that the state strongly advises it, what you can do, meaning you're allowed to do it, or what you should not do or cannot do while you're providing counseling services to patients and clients in substance use treatment programs. There are multiple layers of administrative oversight for alcohol and drug counseling activities, meaning that there's multiple entities or regulatory bodies that are imposing requirements, creating rules or conditions or restrictions, setting standards, and enforcing compliance or administering penalties for the alcohol and drug counseling profession. So this includes state laws, this includes administrative agencies, ethics boards, etc. The primary entities that regulate alcohol and drug counseling in California include first the state laws, those bills that have been passed through the state legislature and signed by the governor. The Department of Healthcare Services is a very important regulatory administrative agency in the state of California that has dominion over everything that relates to substance use treatment. We'll talk more about the Department of Healthcare Services a lot in this lecture. And there are 3 certifying agencies that are currently accredited by the state to administer alcohol and drug counselor registration and certification. Essentially, the state has given up the administrative aspects of registering and certifying drug and alcohol counselors. The state still sets the standards and sets the laws and the regulations for drug and alcohol counselors, but they're accrediting other organizations to do the administrative work. Throughout the years in California, there have been numerous agencies that have been accredited to do this, but currently there are only 3. So the Addiction Counselor Certification Board of California, or the ACCBC, that is an offshoot of the California Association of Alcohol and Drug Educators, the California Association of DUI Treatment Programs, or CADTP, and the California Consortium of Addiction Programs and Professionals, often referred to as CCAPP. So the ACCBC, CADTP, and CCAPP all have equal authority in the state of California to register and certify counselors, although each of them are slightly different in how they administer that process, which I will talk about a bit more later on in this lecture. So note that United States federal laws also regulate alcohol and drug counseling, and local municipalities, meaning cities, towns, counties, etc., can also regulate alcohol and drug counseling in their jurisdictions. So yes, in some cases, this feels a bit like there are too many chiefs and rulers out there that we need to respond to when working in the alcohol and drug counseling field. Now, the interplay of federal, state, and local law is a very important topic in political science and civics. I encourage everyone to know a lot about that, since basically all those laws at the various levels dictate a lot of what all of us are able to do in our lives as United States citizens, but this will not be covered in detail in this lecture. In general, when there's a conflict, federal law supersedes state law. and state law supersedes local law. But it's not quite so black and white. There are exceptions and contingencies, which again are beyond the capacities of this particular lecture about the various regulatory bodies that pertain to alcohol and drug counseling. It is very important that alcohol and drug counselors are familiar with the California regulations for their profession if they intend to work in the state of California. California's regulations are generally in line with federal regulations, but they have much more detail and additions that are not accounted for in the federal laws that pertain to alcohol and drug counselors. The California counties generally conform to the state regulations for alcohol and drug counselors, meaning no matter what county an alcohol and drug counselor is in the state of California, typically anything that the county might have to say about how alcohol and drug counselors are supposed to do their profession, that will be in line with what the state says. And in fact, there are a number of state laws regulating alcohol and drug programs that reference cooperation between the state and the counties. The Health and Safety Code 11778 specifically notes that it is the intention of the state of California that the state administrative agencies and the counties, quote, maintain a cooperative partnership to assure effective implementation of the laws for substance use treatment. Essentially what the state is saying there is, look, we don't want the counties to be making laws that are contrary to what our wishes here, and we want to work with the counties and hear what their concerns are so that we can take care of that on the front end administratively so that we've got a cooperative partnership. So this is why for an alcohol and drug counselor working in the state of California, it's important to know any federal laws that pertain to our profession, and of course, any local county laws that pertain to our profession. But it is critical that we understand the California rules and regulations because those are going to be the predominant rules and regulations that impact day-to-day life as an alcohol and drug counselor. In this lecture, we will cover the three primary regulating bodies in three parts. The first part is California state laws. So we'll dip into California state laws, talk a little bit about what the laws are, and discuss a selection of state laws that apply to drug and alcohol counselors. Part two will address the California Code of Regulations, or the CCR. So the California Code of Regulations is similar to state law. The Code of Regulations regulates state administrative agencies. There's something like 200 state administrative agencies in California. The one that has a lot to do with drug and alcohol counseling is the Department of Healthcare Services. And the California Code of Regulations regulates the things that the Department of Healthcare Services does as well, as do the state laws, which we'll see shortly. So there's definitely overlap between the state laws and the California Code of Regulations. And then the third part of this lecture that we'll talk about are the professional ethical codes of conduct that are published in the California Code of Regulations and which are published by each of the three current state-approved accredited certifying agencies that administer alcohol and drug counselor registration and certification. Professional and ethical codes are not laws, which are covered in another lecture that discusses laws, ethics, and morals, and how the three of those interplay in our work as alcohol and drug counselors. But the ethical codes of conduct are extremely important in order to maintain registration and certification as an alcohol and drug counselor, in addition to protecting oneself from civil suits, for malpractice and things like that. So we'll cover that in part three. All right, California state laws. California state laws regulate activities in the state, meaning anything that anybody could potentially do in California, there may be a law that says something about that. Activities like driving a car or opening up a business or eating at restaurants, all the different activities that we may do in the state. There are many state laws that regulate those activities, and state laws are enforced by the courts. State laws also create and regulate the administrative agencies that oversee activities in the state, meaning that state law can create an administrative agency that may not have existed before, specifically for the purposes of overseeing the administration or the carrying out of the laws that the state makes in any particular area or subject matter. Now, it's important to note, while I said that we're not going to cover political science and civics here, in the United States, the states retain plenary power to make laws covering anything not preempted by the federal Constitution, federal statutes, or international treaties ratified by the US Senate. What that basically means is that if the federal government doesn't say anything about a particular activity, meaning there's no law or statute or treaty, then the states have the right to go in and make their own decisions about how they want to handle that particular activity. We'll talk in a later lecture about the federal laws, particularly as they pertain to confidentiality, which the federal government has a lot to say about. But there are many different aspects of day-to-day work that alcohol and drug counselors do that the federal law basically leaves it up to the states to decide how they want to handle that. All right, the state laws are referred to as legal codes. The way that this process happens is the laws start out as bills, which are essentially proposals that a state elected representative puts forth. So somebody's got an idea, hey, I think we should come up with a law about this particular idea. And so what happens then is those bills or proposals go to a committee. Throughout the committee, they're discussed, and then they're brought to the state legislature. There's two branches in California who debate those. If that law gets passed in both houses of the legislature and is approved by and signed by the governor, then they become laws in the state. And those laws then become part of the California legal codes. So the legal codes are the comprehensive collection of all the state laws that pertain to a particular subject matter. And then those laws are grouped into categories. For example, all the laws that California has passed that are related to crime in this state are generally grouped in the category called the penal code. Another example would be the business and professions code. So the business and profession code is a category of legal codes in which all the laws regarding business-related activities in the state are addressed. There are currently 29 California legal codes, again, meaning there are 29 broad categories of subject matter that contain all the laws that relate to those subjects or to that particular subject matter. The primary legal codes that affect alcohol and drug counselors are the laws in the health and the safety code. There are lots of laws about alcohol and drug counseling and substance use treatment in the health and safety code. Although there are also some relevant and applicable laws in the business and professions code, the welfare and institutions code, and the penal code. So we'll talk about a couple of those there. But essentially, while there are laws pertaining to alcohol and drug counselors spread across multiple categories or codes, the primary one is the health and safety code. Each of the 29 codes consists of numerous individual laws that are all assigned numbers. So in the health and safety code, there are lots and lots and lots of individual laws, and each law that is inside the health and safety code is assigned a number that is particular to that law. For example, Health and Safety Code 11831.6 is a state law under the Health and Safety Code that prohibits any substance use treatment facility, its owner, directors, or employees, and any registered or certified alcohol and drug counselor from conducting any kind of patient brokering activity. Patient brokering is when a person refers another person who's seeking substance use treatment to a particular facility and then is paid by that facility for the referral, either by a commission or a salary or through gift or through trade in some sort. So essentially what that looks like is, I am out there and I'm making contact with somebody who is seeking drug treatment, or I manage to convince them that they should seek drug treatment for their heroin use disorder. And I have a relationship with Juan's treatment facility across town. And what I do then is I go to Juan and I say, hey, I got another client for you. Juan says, great, send the client over. And so I send that client over, and then Juan comes back to me the next day and says, hey, that client enrolled in our program. Thank you so much for bringing them. Here's your commission of whatever, $100 for bringing the client to me. So that's illegal. If any person who works in the substance use treatment field attempts to refer or connect a potential client to any treatment agency, and they refer anything of value back for that referral, that's illegal per the Health and Safety Code 11831.6. And the penalties for doing patient brokering, if you work in the substance use treatment field, include fines and suspension or revocation of your registration, certification, or license. So that's an example of a particular law, one specific law, with an assigned number that exists inside of the Health and Safety Code. Now, there are many California laws that regulate substance use treatment programs. I'm not going to talk about the laws that regulate substance use treatment programs in this lecture. The laws that regulate substance use treatment programs should be very familiar to the administrative folks who are running substance use treatment programs. So owners and directors and program managers and supervisors in substance use treatment programs need to be aware of all the different requirements of a program itself. But there are also many California laws that regulate alcohol and drug counselors. So an alcohol and drug counselor may move from treatment program to treatment program throughout the course of their career, but there are some laws that follow the counselor, not the treatment programs. So we'll talk about a couple of those laws here in just a second. But note that all California laws can be accessed and searched through the website LEGINFO or leginfo.legislature.ca.gov. When you go into that website, there is actually a text search option so that you can put any words you like in there and search for any law out there that relates to that word. So you could put in alcohol drug counselor into the text search and say go, and it'll give you back all of the relevant laws in the state of California that pertain to alcohol drug counselors. So like any search, sometimes there's some nuances to that. You need to make sure that you're using the correct word. Like if you put in counseling instead of counselors, then it may not return what you're looking for. Whereas if you put counsel, like COUNSEL, and then put that, then it'll return everything that uses the stem of that word. The topic for a different lecture, but the bottom line is you can access and search all the laws in California at that particular website. All right, as mentioned previously, there are many California laws that either directly or indirectly affect alcohol and drug counselors. It is always important to consult with supervisors and legal experts when you're unsure if a law applies to a particular situation. Now, I'm going to provide a selected sample of some of the important laws that affect alcohol and drug counselors working in the state of California. However, the laws that I'm going to mention in this particular presentation are neither exhaustive nor all-inclusive, meaning I am not listing every single law that pertains to drug and alcohol counselors in California, nor am I even listing most of the laws that pertain to drug and alcohol counselors in California. I'm going to just show you a sample of laws that pertain to working as a drug and alcohol counselor in California. Again, make sure you consult with supervisors, attorneys, credentialing agencies, the ethics boards, whenever you have any kind of legal questions or concerns. All right, well, let's talk about the California Department of Healthcare Services, because boy, there sure are a lot of laws that pertain to the DHCS and its relation to its oversight of alcohol and drug counselors in California. So Health and Safety Code 11830.1 authorizes, so the state authorizes the California Department of Healthcare Services, or the DHCS agency, to create standards, qualifications, and regulations for substance use treatment and alcohol and drug counselors. So the regulatory agency or administrative state agency that sets all the standards and criteria and regulations for substance use treatment and alcohol counselors is the DHCS. Essentially, the DHCS has dominion over everything substance use treatment related in the state of California, which includes the professional activities of alcohol and drug counselors. What I mean by that, the professional activities are the things that you do while working as a drug and alcohol counselor, not the things that you're doing on Saturday while you're hanging out with your kids. So, a couple of laws pertaining to the DHCS. So Health and Safety Code 11831.7 states that the Department of Healthcare Services may investigate any allegations of wrongdoing, misconduct, or malpractice by a substance use treatment facility or a registered or certified alcohol and drug counselor. So if you do something, or if you're accused of any kind of wrongdoing with your work out there in the field as an alcohol and drug counselor, then the state says the Department of Healthcare Services is allowed to and should investigate that. And in the case of an alcohol and drug counselor, the Department of Healthcare Services explicitly states that it can, quote, suspend or revoke the registration or certification of a counselor for a violation. Now, there can also be fines and even imprisonment, depending upon the nature of the misdeed by the alcohol and drug counselor. But again, the Department of Healthcare Services has dominion over everything substance use treatment related in the field. So if you do something inappropriate as a drug and alcohol counselor and somebody accuses you of that, the Department of Healthcare Services may investigate and then administer punishments accordingly. Health and Safety Code 11833 is a pretty significant law for alcohol and drug counselors. If you pull that law up on the state website, it's a long law, covers a whole bunch of various aspects. First, it states that the Department of Healthcare Services has, quote, sole authority in state government to determine the qualifications, including the appropriate skills, education, training, and experience of personnel working within alcoholism or drug abuse recovery and treatment programs. So this means you. What it means then by sole authority. So essentially the state of California is saying, look, nobody else out there, no other regulatory agency or private agency or even a credentialing agency gets to determine the qualifications and appropriate skills and education and experience that somebody has to have in order to work in a drug and alcohol treatment program. That is only the province of the Department of Healthcare Services. Now, the province of the Department of Healthcare Services does mean that the Department of Healthcare Services can allow an accrediting agency, for example, to come up with some additional stipulations, as is the case with some of the ethical codes that we'll talk about later in this lecture from the 3 accrediting agencies. But the Department of Healthcare Services is the sole authority. They are the final word on what happens to anybody in order to get into and continue working in substance use treatment. Essentially, this law and many others in the California legal codes establishes that the Department of Healthcare Services is the ruling lord of the land regarding substance use treatment and reserves the right on its own to decide what you need to do to be qualified and approved to work as an alcohol and drug counselor. The law also states that, quote, any individual providing counseling services in a substance use treatment program must be registered with or certified by a certifying organization approved by the Department of Healthcare Services. As I mentioned earlier, that's currently the ACCBC, CADTP, and CCAPP. Or if they're not registered or certified, they must be licensed. Now, licensing will apply to any mental health clinicians, psychiatrists, nurses, et cetera, who may also be working at a treatment program. Now, registering with a certifying organization simply means that you are registering with that organization as a supervised pre-certified intern. So many of the students in the alcohol and other drug studies program at San Diego City College get jobs out in the substance use treatment field, but they haven't quite become certified, maybe because they're missing some classes. And so they come to the college and they get those classes so that they can then meet all of the education requirements that the Department of Healthcare Services has established in order to work out in the field and sit for the certification exam. So registration means that you have not completed all of your qualifications to be certified. Certified means that you've completed all of your education, which includes a semester-long practicum or work experience and a minimum of 2,080 hours of supervised experience, and you've passed the certification exam. So in order to work in the field, what basically this is saying is that individuals providing counseling services and substance use treatment are doing clinical work. And clinical work in the state of California is regulated. You can't just do clinical work without doing particular types of training and passing exams. So if you're going to be working in substance use treatment, you either need to be registered or certified or licensed as per the Department of Healthcare Services. The law also states that prior to registering or certifying as an alcohol and drug counselor, the certifying agency must contact the other approved certifying agencies to determine if the applicant has ever had a registration or certification revoked. What this law does is essentially ensures that if you were reprimanded or disciplined by one certifying agency for doing something illegal or unethical, there's going to be no going around the back door to get registered or certified with another. So in other words, if you were certified with CCAPP, and you did something inappropriate and CCAPP revoked your certification, you can't then go to CADTP and put in a new application and get certified through them. So it's state law that says that those three certifying agencies need to be communicating with each other to ensure that everybody who's certified should be certified. Related to that, this law goes on to say that if your registration or your certification has ever been revoked by a credentialing agency or the Department of Healthcare Services, note that your credentials can be revoked by both. If you've had your certification revoked, you will automatically be denied at any subsequent application, and then you need to appeal the denial through your agency and up to the Department of Healthcare Services itself. Meaning that if it's been revoked, you are permanently revoked. There's no stipulation of after 6 months, then you can just recertify again. If you've lost your certification, then you're going to have to go through an appeal process in order to get that back. All right, let's touch upon a different law here. Just as an example, I wanted to show you that not only do laws pertain to the various qualifications and experience and licensing, certifying, registering aspects that you need to do. The laws also make statements about treatment itself. So there's many treatment laws that are out there. This is just a simple example of one, the Health and Safety Code 11831. It's referred to as a quality assurance law. It's under the Quality Assurance Chapter in the Health and Safety Code. And it states that, quote, to the maximum extent possible, a reasonable effort to refer a client to other programs, facilities, or services is encouraged for any program or facility which is unable to accept a client after initial assessment. So what that means is if a client comes into your program and you assess that client, and for some reason, you cannot take that client, either you have no beds available in your program, or the client has a psychiatric condition that's currently not stable, and the client needs to be referred to a higher level of care for stabilization before they participate in, say, outpatient substance use treatment, whatever the situation is. If you've assessed them, you're responsible for them, which is basically what the state is saying. And what they're saying is that if a client comes to you, you need to make an effort to refer that client to another program if that's appropriate. Now, this law in particular, the wording on this law may make it difficult to enforce. These are actual, like, quoted text in the law. I'm not sure how you define maximum extent possible, nor how you define reasonable effort. Those seem like rather woolly, vague terms, but all you got to do, if you're wondering, is ask the lawyers. I'm sure the lawyers have all kinds of ideas about how you can define phrases such as that. However, the intention is clear. The state wants substance use treatment programs to do their best to connect potential clients with the right treatment, not just turn them away because they don't meet program criteria or capabilities. This is consistent actually with the federal no wrong door policy, which is a federal regulation. This is discussed at length in the AODS 159 co-occurring disorders in alcohol and drug counseling course at San Diego City College. But basically the no wrong door policy says the same thing, that if a person shows up at your treatment facility looking for services, it is your responsibility to assess that person and then to pass them off whenever possible to a more appropriate treatment facility. There's some discussion too about that pass off should be a warm handoff, meaning you don't just give a client a sheet of paper saying, call these people, they're across town, best of luck to you. It's your job as a treatment facility to make that phone call and attempt to connect the client to the treatment program you're referring them to. And remember, don't collect any money for referring a client to another treatment program. That's illegal. Okay, so sometimes there are so many individual laws pertaining to a particular topic inside of one of the legal codes, they get grouped together. And if you pull them up, you'll see it's just law stacked on law stacked on law that kind of follow each other about a particular topic. So here's an example in the Health and Safety Code, sections 123.100 through 123.149.5. That area contains all the laws concerning patient or client access to their health records, which includes all substance use treatment records. So essentially, this group of laws states that any client or patient who receives substance use and other healthcare treatment has the legal right to review and request a copy of their own medical records. They have that right by law. That's also true in federal law. They have that right as well. So that's an important thing for alcohol and drug counselors to keep in mind, because one of the requirements that we have, which is also covered in some of the state laws, not covered in this presentation, is that we need to document all clinical services, including assessments, discussions of treatment plans, individual counseling sessions, group counseling sessions, et cetera. But you need to keep in mind that everything you write in documentation may actually one day be read by the very client that you are documenting. I have personally had this happen numerous times in my career, where a client that I've worked with has made a request for a copy of their own medical records, which I had to give to them as per state law. So this is something that is definitely worth discussing with supervisors and peers and other professionals related to documentation, what you should document, how you should document it, but that will not be covered in this particular course. Sorry, this particular lecture today. All right, I wanted to shift out of the Health and Safety Code and show you some laws that pertain to drug and alcohol counseling that exist in some of the other codes. So the Penal Code. So Penal Code 1164 through 11174.3. I think I missed a one in that first one. 11164 through 11174.3. These reference all the laws that cover the mandated reporting requirements and procedures for alcohol and drug counselors to report suspected child abuse or neglect. Now, the law also clarifies while there will never be a penalty for making a report, meaning that if you report suspected child abuse or neglect, you will never get in trouble for that. Nobody can ever come after you, sue you, do anything to you, fire you. There can be no penalty for making a suspected child abuse or neglect report. However, there are penalties for not making a suspected child abuse or neglect report, including fines and potential imprisonment. Now, there are many laws and procedures and regulations as it pertains to reporting suspected child abuse and neglect that will not be covered in this introductory lecture on the laws and regulations for alcohol and drug counselors, but is covered in a different lecture in our AODS 154 Law, Ethics, and Skills in Alcohol and Drug Counseling course. Now, similarly, In the Welfare and Institutions Code, which is not the penal code, but there's actually a section of very similar laws that are over in this category. But in this case, these are laws that cover the mandated reporting requirements for alcohol and drug counselors to report suspected elder or dependent adult abuse. Now, why mandated reporting requirements for child abuse are in the penal code, whereas mandated reporting requirements for elder abuse are in the Welfare and Institutions Code? I have no idea. I'm not a lawyer, nor am I a legislator in the state of California. But anyway, that's where they are. This is one of the reasons why it's best to do a search in the legal codes rather than looking only in the health and safety code. So this collection of laws reference all kinds of the procedures and criteria and processes and punishments about reporting suspected elder or dependent adult abuse. So an elder is defined by the state as any person 65 years or older. So if you're 65 years old, you're an elder as far as the state is concerned. And a dependent adult is anyone between the ages of 18 and 64 who has physical or mental limitations that restrict their ability to carry out normal activities or protect their own rights. That's a legal term. Essentially what it means is that people with moderate to severe physical, mental, or developmental disabilities and or people whose mental abilities have diminished because of age or dementia need to be protected. There's a very vulnerable population, and if there is any suspicion that elders or dependent adults are being abused, we are required by law as alcohol and drug counselors to report that. All right, and the Business and Professions Code. So the Business and Professions Code regulates professional activities of all kinds of different businesses in the state of California. And there are some laws in the Business and Professions Code that also pertain to alcohol and drug counselors. For example, Business and Professions Code 729 states that any physician, surgeon, psychotherapist, or alcohol and drug counselor who engages in any kind of sexual act with a client or with a former client when the therapeutic relationship was ended primarily for the purpose of engaging in a sexual act is guilty of sexual exploitation. What that means is that an alcohol and drug counselor, by law, it is illegal to engage in any kind of sex act. So that up to and including actually having sex with the client. But it also means that if you had a client and you ended that therapeutic relationship with that client primarily for the purposes of engaging in a sexual act, then you are guilty of sexual exploitation. Sexual exploitation is punishable by up to 3 years in jail and a fine of up to $10,000 in the state of California. Clients are in an extraordinarily vulnerable position while they are in treatment. And counselors are in a position of power over those clients while they are in treatment. This is why it's called sexual exploitation. The bottom line is don't ever have any kind of sexual contact with your clients, even if the client themselves initiates the contact. Now, going back to the previous slide, where it states that if a therapeutic relationship was ended primarily for the purpose of engaging in a sexual act, this is sexual exploitation. That means even if the client, if you're working with a client and that client comes on to you as an alcohol and drug counselor, you're attracted to them, they're attracted to you, they want to be with you, and that client leaves treatment and they say, hey, I left treatment, now you're not my counselor anymore. Can we get together? If you, the alcohol and drug counselor, engage in sexual contact with that client, you ended or she ended, either or he, it doesn't matter, that therapeutic relationship for the purpose of a sex act, and that is sexual exploitation and illegal. So on top of being a major clinical violation, this is illegal and the punishments are significant. Don't ever have sexual contact with your clients. All right, so the last slide regarding California laws. As mentioned previously, this introductory lecture on the California laws that regulate alcohol and drug counseling is not exhaustive by any stretch. I talked about just a handful of laws to give you an example of some of the laws that are published by the California legislature. But use supervision, talk to your peers, and use legal support whenever there is a legal question. And if you're not sure if a law applies to a situation, it is your responsibility to do your due diligence to find out if there is a law that pertains to a particular situation. Ignorance of the law is no excuse, and it certainly won't save you from punishments, again, including suspending a suspended license, certification, registration, or it being revoked, or paying a fine, or being imprisoned. So know the laws in your field. I've given you a chance to, or an opportunity to go to a website and do some searches on the laws pertaining to alcohol and drug counseling yourself. So part 2 of this lecture, we are going to discuss the California Code of Regulations and how that pertains not only to drug and alcohol counselors, but some of the regulatory bodies like the Department of Healthcare Services and what they do pertaining to the Code of Regulations.